Do you frequently feel like your heart is pounding, even when you're not doing anything? Or maybe you're skipping meals and still feeling guilty about eating a small snack. These might not just be random worries, they could be signs of something more serious, like anorexia nervosa. Anorexia is more than just wanting to lose weight. It's a mental health condition where a person becomes so afraid of gaining weight that they starve themselves, even when they're already underweight. Imagine your brain sending constant fake alarms, danger, you're getting fat, even when you're actually too thin. That's what life feels like with anorexia. It tricks the mind and harms the body. Would you ignore a friend who looked pale and weak, but insisted they were still too fat? It's heartbreaking, and it's real for many teens and adults around the world. So what makes someone develop anorexia? Think of it like a broken app. On your phone, multiple things go wrong at once. Some people are born with sensitive brains that worry more about control perfection or body image. That's genetics, like inheriting your mom's eye color or your dad's temper. Now add social pressure, like seeing influencers online with perfect bodies and thinking, I have to look like that. Or maybe a tough life event, being bullied about weight, family problems, or high expectations at school. It's like pouring fuel on a smoldering fire. For example, imagine a 16-year-old girl who starts dieting after being teased about her thighs. At first, she loses a few pounds and gets compliments. That feels good, right? But soon she starts eating less and less, chasing a number on the scale. The control over food feels like the only thing she can manage in a chaotic life. It starts small, but grows into anorexia. It's not about vanity, it's about pain, fear, and needing control. How do you know if someone, or even you, might have anorexia? Let's play detective. Look for signs: eating very little, avoiding meals, obsessive calorie counting, or extreme exercise even when sick or tired. Maybe someone weighs themselves 5 times a day, or refuses to eat pizza at a birthday party. They might wear baggy clothes to hide weight loss. But it's more than what you see. Inside, they feel intense fear, like gaining a pound will ruin their life. They might say, I'm fat, when they're clearly underweight. Physical signs: hair falling out, skin turning yellow, feeling cold all the time, missing periods, or fainting. Imagine your body begging for food, but your brain saying no. That's anorexia. It's like running a car without gas. The engine keeps trying, but it's slowly breaking down. And the scariest part, the person often doesn't realize how sick they are. Diagnosis isn't about one test. It's like putting together puzzle pieces. A doctor checks weight, heart rate, blood tests, and asks questions. How do you feel about your body? Do you fear gaining weight? They rule out other illnesses too, like thyroid problems. A psychologist talks about thoughts and feelings. Together, they decide if it's anorexia. Treatment: it's a team effort, like in a sports injury. You need a coach, doctor, and therapist. The first goal: stabilize the body. Sometimes that means hospital care if heart or organs are in danger. Then comes therapy, talking to a counselor using methods like CBT, cognitive behavioral therapy, to challenge harmful thoughts. Imagine retraining your brain to see food as fuel, not food. Nutritionists help rebuild healthy eating habits slowly. Family therapy helps too, like teaching parents how to support without pressure. Recovery takes time. It's not just eat more, it's healing the mind and body together. Can anorexia be prevented? Yes, and it starts with awareness. Think of it like wearing a seatbelt. You hope you won't crash, but you protect yourself anyway. Schools can teach body positivity, like showing diverse body types and banning fat talk. Parents can avoid commenting on weight and focus on health, not appearance. For example, instead of saying you look thin, say you look strong and full of energy. Encourage balanced eating and joyful movement, like dancing or hiking. If a friend starts skipping meals or obsessing over calories, don't ignore it. Say something like, I've noticed you're not eating much. I'm worried. Can we talk? Early help makes a big difference. Prevention is about creating a world where people feel worthy, not just for how they look, but but for who they are. Science keeps moving forward. New research shows that anorexia isn't just a choice. It has brain patterns like other mental illnesses. Brain scans reveal differences in areas linked to self-control and emotion. Some studies are testing new therapies, like using virtual reality to help patients see their bodies more realistically. Others are looking at medications that might reduce obsessive thoughts. There's even work on gut bacteria, since digestion affects mood. One promising approach is Mantra, the Maudsley model of anorexia treatment, which personalizes therapy based on personality. Also, telehealth online therapy is helping more people access care, especially in remote areas. These advances give hope. They show that healing is possible, and support should be too.